At the beginning, we just had this one case, and the hope was, because that person had come back from traveling at another place, that maybe it wouldn't come here. Pretty quickly we started to see another, not related to that person, and then another and another and another, and we knew we were going to be in for some more.
You know, this disease is very different than most of the other ones we've dealt with. No, not everybody has symptoms, so there could be infected people walking around who could be spreading it.
So we began testing for asymptomatic spread early on. One of the first things that we did was work with our Board of County Commissioners and got some money approved. And so around the region, we were able to quickly expand our capabilities to test.
So the idea behind case investigation and contact tracing is to break those transmission chains. And we know that we have not been able to be successful in breaking every transmission chain, but you know, I tell our staff, and I firmly believe that each transmission chain that we can break, each one of those contacts we can identify and get to stay home and do their quarantine and the proper public health mitigation, those are lives saved.
In the Emergency Operations Center, one of the first things that we were focused on was the personal protective equipment, PPE. And so we worked with our partners and our procurement team to come up with a plan to be able to secure enough PPE so that they didn't go without.
Because the virus loves the indoor environment, it loves when people interact together, and in these environments, the long-term care facilities, it doesn't take much. And so one of the things that we did was begin meeting weekly with operators of these facilities and pushing out information to them on how to improve their infection control processes. We also had outbreaks in other facilities, in restaurants. In some cases, we took testing to those facilities. We worked with their HR on who needs to be isolated and who needs to be in quarantine.
We want to make sure that everybody that needed to isolate and quarantine had a safe place to do that. We worked to find safe lodging situations for individuals that didn't have another safe place to do so.
Over the summer, we collaborated with the school districts and other jurisdictions as much as possible to figure out, you know, how do you open school in a pandemic? Is it safe? Is this something we can do? We really had to sort of problem solve through a lot of that.
I think we were able, because of the actions we took early on, to knock things back so that even when we saw the big numbers happen in October and November and December, we never got to the point here where we were totally, completely overwhelmed. We were close. We were getting to that point where there were no real ICU beds available at one point in Kansas City.
And you look at hospital capacity, the number of hospitalization has dropped very dramatically. Residents who bought into what the message is, understood that we have to do this collectively, understood that we have to wear masks, we have to physically distance. So again, it's working, and the more that we get to vaccinate people, the more that we get into temperatures that are friendlier, that's going to encourage more outdoor activity, the better it's going to be.